friends. Good evening. So today we will discuss about diabetes life care data analysis project. Our group number is 5 and myself Patel Roma, and today I will discuss about introduction part. What is the diabetes? So the diabetes is a metabolic disorder in which the body has high sugar level for prolonged period of time. As the diabetes is one of the biggest global public health concerns, it has a significant negative impact on both socioeconomic progress and public health worldwide. One of the top 10 disasters in the healthcare world is the diabetes. The whole burden of the diabetes has grown dramatically in recent decade, and it's expected to keep rising over the coming several decades. There are the three types of the diabetes: type 1, type 2, and gestational diabetes. What is type 1 diabetes? So type 1 diabetes is autoimmune reaction in which the body attacks cells the pancreas that make insulin. Type 2 diabetes is more common and occurs when the body stops responding to insulin and causing your blood sugar to rise. Gestational diabetes, it means that blood sugar affecting the pregnant woman. That means the gestational diabetes. I will describe about the one cause of the diabetes. The main cause is diabetes is genes and family history, and the second is insulin resistance. And the symptoms of the diabetes is blurred visions, weight loss, and increased urinations. Thank you. And the next part will be continued by one of my friends. Her name is Dipti. Thank you.
Hi, my name is Deepti. I'm going to talk about the inclusion criteria and exclusion criteria of the study. In the inclusion criteria, we have included all the diabetes patients who are of type 1, type 2, and a few of gestational diabetes patients. And the data, based on the data that's gathered, we found that the type 2 diabetes patients are in majority than the remaining two types. And the exclusion criteria is we did not consider any healthy patients, and we did not consider the patients who do not have any past history of diabetes, and we did not consider the patients who do not have any family history also. And there are some methods how we gathered the data. We have used with the survey. We found some information. Based on the information, we have analyzed the information and found out the facts. Facts with the help of secondary data. And the topic of choice and the data collection decisions were made after the statistical analysis. And yeah. The next slide is going to be continued by Navateja.
Thank you, Deepti. We have conducted a survey like based on the different age groups. From that, we got the data, and here are the questions that we have asked for the diabetic, the people who are suffering from diabetes. We asked like about the gender, age, type of diabetes, family history, and any other health issues other than diabetes, and vision problems. These are the questions which we have asked in our question Google survey form. And I can show you the Excel sheet. This is the data which we got from different types of diabetic people, like type 1, type 2, and type gestational. So we got we got a good response from these people, and we have analyzed the data. We have analyzed the graphs based on based on the raw data. So here are, and we have created a dashboard. So we have created a dashboard by analyzing all these data. So from these 59 people have been participated, diabetic patients have been participated. From that, 35 members are male and 24 are the female. And from that, we have compared the types of diabetic patients. So from these, we have we analyzed type 2 diabetic, almost 75% of the type 2 diabetic patients are been suffering from our data. And when it compares to the age group, we have analyzed that people between 36 to 50 are been mostly affected with the type diabetes. And along with diabetes, people are most of the people, around 22 from the data which we got, have been suffering from high blood pressure. And most of the diabetic patients have been suffering from weight fluctuations. From that, we have observed that most of the people have gained their weight when compared with that of losing their weight. And the impact of beverages and beverages and food that they are taken by the diabetes patients. So most of the type 2 diabetic patients, in between the above age people, have been having their carbohydrates and more tea in their diet when compared with others like coffee, soda, and other age groups. And now, when it compares to the vision problem, so the people with type 2 diabetes have more vision problems when compared with that of other people. And we have compared the medications taken by different age group peoples with high blood sugar levels when they're having when before meals. So from that, we have observed that the people with high blood pressure above 150 before meals, 150 or above 50, are taking insulin, and 70% are of type 1 diabetic patients. And when it type of medications taken by the patients of different age groups with high blood sugar levels after the meals are people in between 36 to 50 who is having the high blood pressure levels are taking pills, and the rest above 50 are taking the insulin. And the rest of the key findings which we analyze from the data is will be explained by our friend Sharat.
Hi everyone, this is Sharath. Now I'm going to explain about the conclusion of diabetes data. The results show that there are 70% of people with type 2 diabetes. This means that there are more people with type 2 diabetes than people with type 1. The second largest group of people are those who are suffering from type 1 diabetes. Also, diabetic patients who have small problems often go to the doctor, while many people go to the doctor for even small problems. But on the other hand, people with diabetes who have serious health problems prefer to visit the doctor frequently in order to get better than people with other health problems. Lastly, it was found that there was more male patients with diabetes than female patients. This is information about how the people genders compare to each other. It can be said that men are more likely to have diabetes than women. Typically, diabetic people choose tablets over insulin. Sugar in the blood prevents your body from energy, so it burns fat and muscle for energy, causing unexplained weight loss. And these are the most common types of type 1 and type 2 diabetes. Thank you.